What? I don't know. No, I don't know.
Did you get lunch on it? We're good, Jim. Most of the Murphys have the snow blower, everything's going.
Hey,
Good afternoon. The Senate Finance Committee has been called to order. It's Tuesday, January 16th. Welcome, everyone. My one request today is that we have your cell phones turned off if you haven't already done that, please. We are going to hear the bills in this order. Actually, it's a reverse order of the list. So Senate Bill 245 will be first. Senate Bill 238 is number 2. Number 3 is the State Board for Certification of Residential Child Care Program Professionals. Bill number 4 will be State Acupuncture Board, and Bill number 5 is Occupational Safety and Health Advisory Board. So if I can have Marie Grant, would you like to come to the table? We're going to hear from, we'll hear from you first. And also if you would bring with you Mark Luckner and Robin Elliott. Thank you. You're going to spend some time with us today. So we're going to start with you, Marie, and then we're going to go to Senator Ed Casemeyer, who's on virtually because of the weather today.
Great, thank you so much. Madam Chair, Madam Vice Chair, committee members, Marie Grant on behalf of the Maryland Department of Health, kicking off some departmentals relating to sunset extensions of our boards and commissions with Senate Bill 245. So this legislation relates to the Maryland Community Health Resources Commission. It's a sunset extension and program evaluation. The bill would extend the sunset of the commission by 3 years to June 30th, 2028, and also have a statement that it is the intent of the General Assembly that a program evaluation be conducted of the commission. The commission, as Mark and Chair Casemeyer will tell you all about, is very important to the state, does a lot of great work, has had its duties expanded significantly in previous years. And at the department, we're taking a uniform approach. You'll hear me say very similar things for the next few bills, recommending a 3-year sunset extension, and in this case, giving the opportunity for a program evaluation, which to our knowledge has not been conducted of the commission previously.
Thank you.
So,
Senator Casemeyer, would you like to give us your testimony?
Well, thank you, Madam Chair. I'm Ed Casemeyer. I'm Chair of the Community Health Resources Commission. And before I might begin any comments, I'd like to congratulate you on being named chair and hope that over the years we continue to work very closely together as we already have. Senate Bill 245, as Ms. Grant said, is a very simple bill. It extends our sunset from 2025 to 2028 and calls for a legislative evaluation by the Department of Legislative Services. I'd just like to make a few comments about the history of the commission. The original legislation in 2005 was approved by the Senate Finance Committee, and for the last first 15 years, primarily our primary function was to provide grants to communities who were underserved medically. And over those years since 2005, we've actually approved over 700 grants for about $125 million. to all 24 jurisdictions in Maryland. And I'll bet 75% of our grants have continued on after the grant period had ended. And we're very proud that these grants have been sustained over the years. In recent years, the legislature has had the confidence in us to request that we administer 2 new programs. One, the Maryland Health Resources Act, which was sponsored by Senator Hayes, as a matter of fact. And the second, that was part of the blueprint legislation, the Maryland Consortium on Coordinated Community Supports. And now, after that modest beginning back in 2005, these 3 programs, we have over $685 million in funding requests before us. And we will be making decisions on these in the next few months. I wanted to say that our staff has expanded significantly, and we really have a top-notch staff. They've done an incredible amount of work, and Mark Luckner does an exceptional job of leading that staff. So once again, I fully support Senate Bill 245. It has no fiscal note or a fiscal impact to the state. And thank you for letting me testify via Zoom. I appreciate it.
Thank you, Senator Case-Meyer. Thanks for this important work. We know how important it is that we provide health care to everyone. So I really appreciate your work.
Thank you.
Thank you. Nice to see you.
Good luck.
Thanks. Mark Luckner, would you like to testify?
I'll just keep my remarks very brief. Madam Chair, congratulations on your appointment. Mr. Chairman, thank you for your comments, and Marie Grant, thank you for your comments. Like they say, me too. Chair Case-Meyer hit all the key points. Thank
We
you.
always say extra points for that, Mark. So
Me too.
And Robin Elliott, comments?
Good afternoon. Robin Elliott. I just wanted to start off with a little bit of history. I was at the Department of Health when this bill was created. I worked with Delegate John Herson, and Mark Luckner was staffing HGO at the time. And I don't think Marie was around yet. You were in finance?
That was actually HGO for one session.
Oh, so we're bringing the band back together this afternoon in support of this bill. Mark is only the 2nd executive director. This commission has had amazing stability and has really made a difference in community health centers being able to innovate and grow. And they give out grants to help start up. Recently, with the implementation of adult dental by Medicaid, the commission's work to build up the capacity in community health centers has really helped. So I have several clients that are strongly in support: the Maryland Community Health System, which is a group of FQHCs, the Maryland Assembly of School-Based Health Centers, and then of course the Maryland Dental Action Coalition. All urge a favorable report, and thank you very much.
Thank you. I think everyone has testified. Do I have any questions? Senator Lamb?
Thank you, Madam Chair. Good to see everyone again. Good to see you, Senator Case-Meyer. It's always good to reconnect. The commission does great work, certainly support all the work that Mr. Luckner has put into it, and want to also express our appreciation for the consortium work, because I know there's been a lot going into that to make that happen. The question that I had to pertains to the inclusion, the provision there for the Office of Program Evaluation and Government Accountability. So I chair the Joint Audits Committee, which oversees the work that OLA does, as well as OPEGA, which is a new office that was created just a couple years ago and only has, I think, 4 or 5 staffers in it. And so I'm curious to understand in this bill, which fully support the sunset extension, of course, the program evaluation piece that pertains to OPEGA about doing an evaluation of the commission itself, trying to understand what the origins of that are, because as a small office last year, OPEGA spent probably the majority of their time reviewing requests that came in through legislation. And OPEGA, as it was originally envisioned, was something that the presiding officers working with the director of DLS would kind of take a more global view of evaluations that might need to take place of various departments and agencies, and be able to do a deeper dive into those offices. And so the thought here is that if we continue down the path of having legislation direct the work of OPEGA, that they're not going to have that flexibility to be able to look into various departments and agencies depending on what members request or what comes forward from the presiding officer. So just like to hear about that provision's inclusion in this bill.
Yeah, thank you, Senator Lamb. Those are all great questions. I think when the Department of Health was looking at this extension and request, our other boards and commissions have gone through this process. At some point, I understand there's been a lot of changes to the structure of how program evaluation is being done in the past couple of years. But it was the recommendation that the Secretary of Health that we take this look at the commission, take the opportunity to take that look as we have done with our other boards and commissions. I think that all being said, we're definitely very open to that process, right? If there's a different way to go about this that you all would recommend, we'd certainly defer to you all and happy to work with you all on that provision.
Okay, because there are obviously a lot of commissions and boards that are part of or extensions of MDH. I guess just thinking through the bandwidth of OPEGA, this could really go down a pathway where they could be pretty stacked up. Is it something that the department would have the resources to do this type of evaluation internally, or what's your take on that?
So I think our thought in this case, our regulatory commissions are independent, right? They are chaired by Chair Casemeyer, independent commission. And so I think our thought in recommending that it come from the Office of Program Evaluation is that this is an independent legislative look, right? But that all being said, I think if it was the will of the committee to have the department look at the possibility of an evaluation, I think we're very open to that suggestion.
Okay. All right. Thank you, Madam Chair.
Senator Lamb and Senator Hayes.
Yeah, thank you, Madam Chair. To Senator Lamb's point, I think it was our committee counsel, David, who educated me on this in previous sessions, and that historically, whenever a board or commission was coming before the legislature, there was a review that was conducted. A couple of years ago, this policy was changed, and it's been pretty much left into the legislature and making an affirmative request in order for an evaluation to be done. And so it's interesting that we're going back this way. Do you see this kind of does the department see this as kind of like standard practice going forward? Or is it just this board and commission is it just this commission that you guys are looking at to do the review?
Yeah, thank you, Senator Hayes. I think for this, it really was the special case because this commission has not gone through this kind of review to our knowledge before.
Gotcha, thank you. And Madam Chair, just, point of privilege, not a question, but just a statement. Since introducing the HERC legislation, I served on HGO, but not until most recently in the last couple of years, had an opportunity to work with this commission, with the chair, as well as the staff there. And they are an awesome resource to many of our communities. And so look forward to supporting the continued work that you guys do around access, and especially as it relates to the HERC legislation. Thank you all so much for coming.
Thank you.
Are there any other questions from our senators? Well, thank you very much. And Ms. Grant, I think you need to stay at the table.
Okay.
Thank you. We are going to go to Senate Bill 238, State Board of Dietetic Practice Sunset Extension.
All right, so thank you so much, Madam Chair, committee members. Again, I'll be saying very similar things for the next few bills. This is a bill that would extend the sunset date of the Board of Dietetic Practice by 3 years. This, again, we're recommending this extension across our boards and commissions, as you just heard with the Community Health Resources Commission. As the secretary enters the Department of Health, or she's entered in January, has been really excited about reinvigorating the relationship of the department with the boards. There is, I think, in hopes to take a holistic look, I think, at all things IT, workforce, the role of the boards in workforce. And so, again, we're taking this uniform approach of 3 years across our boards. So with that, recommend a favorable report and happy to answer any questions.
Thank you. We have a couple of people virtually. I think Marie Savage would you like to testify?
Yes, thank you. Good afternoon. My name is Marie Savage and I am the Director of the Board of Dietetic Practice. This is the board's fourth sunset in the history of the board. I've been the director for 17 years and historically have received tenure extensions. During the last sunset evaluation, the only recommendation from the auditor was that the board get cease and desist authority, which passed the following legislative session. We now offer online applications, online renewals, online verifications. Our meetings are held virtually and in person. And even when we have an in-person meeting, we have the meeting available virtually so the public can access our meetings. The board did not have any deficiencies during our last legislative audit the last 3 years. So we are respectfully requesting a 10-year extension, and I'm available to answer any questions you may have. Thank you.
Thank you. And then we have Rebecca Snow.
Hi, good afternoon, Senator Bidel, members of the Financial Committee. I'm Rebecca Snow. I'm board chair for the Maryland Board of Dietetic Practice. This is my second 4-year term of service to the board and to the state of Maryland. The board protects and serves the public by upholding quality standards for the practice of nutrition and dietetics in the state of Maryland. The board ensures a strong workforce of professionals to address chronic and preventable disease, such as diabetes and heart disease. Our licensed professionals work in a variety of settings: hospital, nursing homes, nonprofit, private and public clinics. In addition to the board's efficient and economical operating history, which Marie points to, the board has an excellent long-standing relationship with the 2 major national credentialing bodies and their Maryland chapters, the American Nutrition Association and the Academy of Nutrition and Dietetics. On behalf of the board, I'm respectfully requesting a 10-year extension of the board, and I'm available for any questions.
And last, we have Leslie Jackson Delayed. Did I say that right?
Yes. Good afternoon, Madam Chair. My name is Leslie Jackson Vallad, and I'm a certified nutrition specialist and a licensed dietitian nutritionist in the state of Maryland. I'm also the chair of the Maryland Nutritionists Association, which is a chapter of the American Nutrition Association. With the ongoing backing of the ANA, the MNA chapter represents over 340 certified nutrition specialists in the state. And we are here today to voice our full support for Senate Bill 238 and the continuation of the Maryland Board of Dietetic Practice. As the board ensures that nutrition professionals, both CNSs and RDs, adhere to high standards, which actually leads to improved quality of nutrition care for Maryland residents. Its initiatives and regulations help meet Maryland's workforce needs by maintaining a very high caliber of trained and certified nutrition professionals that work in a variety of settings like hospitals, clinics, and private practices. Lastly, by regulating and overseeing the licensure of nutrition professionals, the board plays a crucial role in safeguarding the public from unqualified practitioners and ensuring ethical practices in nutrition care. Thank you for your time.
Thank you. Thank you very much for your testimony. I do have a question, if there are no other questions. Ms. Grant, this is the Health Department's recommendation for a 3-year extension instead of a 10.
Yes, and across the board, we're taking this approach uniformly. You'll hear the same thing, no matter the board and the circumstance. We're really trying to take this holistic look at our boards. So it's 3 versus 10.
Thank you for answering that. Any other questions from any senators? No questions. Thank you very much. Thank you for your testimony on Bill 238. Now we'll go to Bill 237, State Board for Certification of Residential Child Care Program Professionals. And I have a list. So of course, Ms. Grant, you'll stay at the table along with Darlene Ham and Nicole Smith, and they're both virtual. So would you lead for us, please, Ms. Grant?
Yes, thank you very much, Madam Chair. Committee members, again, another 3-year sunset recommendation for this board and would urge a favorable report.
Thank you very much. Okay, so next we'll hear from Darlene Ham. You're muted. Please unmute.
I'm sorry. Good afternoon, Madam Chair, members of the committee. Thank you for allowing me to testify before you today. My name is Darlene Ham, and I am the Executive Director for the State Board for the Certification of Residential Child Care Program Professionals. I am here today in support of Senate Bill 237. This bill seeks to continue the State Board for the Certification of Residential Child Care Program Professionals in accordance with the provision of the Maryland Program Evaluation Act Sunset Law by extending the board's existence to July 1, 2028. The passing of this bill will ensure the continuation of the board's mission to protect the children living in Maryland's residential child care programs and to promote quality care in the field of residential child care. The State Board is a certification authority for residential child care program administrators and residential child care practitioners. The State Board has continued to deliver services for our certified program professionals and potential new applicants with very limited delay in service. The board is compliant with OLA audits and complies with all audit requests and works diligently with the auditors to provide any documents or anything else required to meet their standards. We are happy to report there are no outstanding audit findings. The board is compliant with new federal laws regarding veterans and spouses. There are no outstanding licenses, renewals, or complaints, and no overdue constituents inquiries. Therefore, it is crucial for this bill to pass in order to protect the children living in Maryland residential programs who are among the most vulnerable children in this state by certifying qualified individuals. The board supports Senate Bill 237 to the existence of the year July 1, 2028. And thank you for consideration for this legislation. For this reason, the board is requesting a favorable report on Senate Bill 237. Thank you. I'm here to answer any questions.
Thank you very much. Do I have any questions from the senators? Thank you, Senator Ellis.
Yeah, thank you, Madam Chair, and thank you, Ms. Graham, Ms. Ham. This board, how does it work with, or is it a part of the State Department of Education? Because I thought State Department of Education were involved with childcare and I'm not sure.
If it's all right with you, Senator Ellis, I would love for Ms. Ham to talk a little bit more, but this is specifically relating to residential childcare. So it is a different scope of services that's provided.
Yes, this board works with employees that work in residential childcare facilities where kids actually live, group home settings.
Okay, so if I understand you correctly, those home childcare facilities, they take children from other families, right?
These kids are kids that are in foster care.
Oh,
and placed in group home care.
okay.
Yes, and we certify the employees that are that work in these facilities.
Okay.
This
Thank you for that. So I know on the broader child care area, the child care providers are certified and supervised by the Maryland Department of Education. So these residential facilities, they also have to deal with and work with the State Board of Education in addition to the State Board for Certification of Residential Child Care Professionals.
The employees that are working in child group homes, they are certified to be program administrators or child and youth care practitioners. So, and they work in licensed residential child care facilities. These are kids that are they live there basically until other plans are in place.
Yeah, okay. And so thank you for clearing that up. I'm concerned because let's see, the blueprint talked about early childhood and working with child care providers and getting them to provide not just a babysitting kind of services. So I was wondering if in these facilities, if they're working with the Board of State Board of Education to basically meet their standards and to really provide that kind of early childhood education. And that's my concern. But you can follow up with me offline. I don't want to take up too much of your time, but I'm concerned about that particular
Okay.
Yeah.
issue.
And Senator Ellis, if I may, I do think, and happy to talk more offline, these particular folks who are licensed and certified under this board are, it's a pretty rigorous process because these are, you know, kids that sometimes enter the system through DHS or DJS and, you know, are certainly vulnerable and need a lot of care. And so,
Yes.
so there's a robust system of regulation in place for that.
Okay, thank you.
Ms. Grant, I think, if I can,
Yeah.
we're kind of concerned about what's their education availability? How are they
Gotcha.
educated? Is that what we're getting to, Senator Ellis? Thank you.
Gotcha. Okay.
Yes.
So if we could hear
That's
back
helpful.
about that at some
Yeah.
other time, maybe. Thank you
Yeah,
very much.
absolutely. Thank you.
Senator Hayes?
Thank you, Madam Chair. I heard the testimony say that you all certify the employees, but do you all license the providers, or is that a separate entity that do the
That's a
licensing?
separate entity. That's Department of Human Services or Department of Juvenile Services or Department of Disability. So they're licensed. They license them. We license.
Separate.
Yes, it's totally separate. We
Excellent.
license the employees. Yes.
Thank you so very much, Madam Chair.
There are no other questions. We'll hear from Nicole Smith.
Good afternoon, Madam Chair and members of the committee. Thank you for the opportunity to testify before you today. My name is Nicole Smith, and I'm a board member on the State Board for the Certification of Residential Child Care Program Professionals, and I'm here today in support of Senate Bill 237. In addition to being a member of the board, I'm also a certified program administrator, and I provided leadership in a residential child care program for more than 20 years. As the executive director of the Board of Child Care, a non-for-profit human service agency and one of the largest residential child care providers in the state of Maryland, I value the oversight the board provides to promote an additional layer of safety for the youth and families we serve, as well as validate the competency of residential youth care professionals and administrators. This certification process is an important requirement to promote a qualified and well-suited workforce. Amending the board's existence to July 2028 will ensure the certified program professionals will continue to deliver services in residential childcare programs like my own. Thank you for consideration of this legislation. For these reasons, the board is requesting a favorable report on this bill.
Thank you, Ms. Smith. Do I have any questions for this witness? No questions. Thank you very much. So that ends the hearing on Senate Bill 237. And I think this is your last one, Ms. Grant. I'm sorry, is that 237? Okay. So next we have a lot of paper up here. 236, the State Acupuncture Board. Thank you.
Thank you, Madam Chair, committee members. Senate Bill 236 extends the sunset date of the State Acupuncture Board by 3 years. And so we urge a favorable report. Thank you.
Thank you. And let's see, Senate Bill 230. I'm sorry. What are we on 236?
236.
This is confusing because this is, no, that's not the problem. This is 238. I'm looking for the witness list for 236. Thank you. It was, so we have two other testimonies for 236. I think they're Tiffany Smith Williams.
Yes.
Thank you. And then we'll have Ms. Purnell virtually. So thank you.
Good afternoon. My name is Tiffany Smith Williams. I am the Executive Director for the Maryland Board of Acupuncture. I am here today in support of the Bill 236 and the Secretary's recommendation, and ask the committee to give a favorable report. The acupuncture bill has protected the public in the practice of acupuncture in East Asian medicine for the last 30 years, and we look forward to doing that for 30 more years in the future. We have no outstanding audit reports. Our complaints and inquiries are all up to date. No licenses are overdue. And I'm new to the board, however, we hope to carry on the tradition that was set by the past state employees who were there for 30 years doing this work. and I'm here to answer any questions for you.
Do I have any questions for this witness? I don't see any questions. Thank you. And our last witness is Ms. Purnell, virtually.
Good afternoon, Madam Chair and members of the committee. My name is Iola Purnell, and I am one of the board members for the Board of Acupuncturists. And I just want to share with you that the board is in unanimous support of the Health Secretary's recommendations to review the board every 3 years, as opposed to the current every 10-year cycle. We believe this adjustment certainly is critical for her to help maintain the highest standards of acupuncture care and ensuring the ongoing effectiveness of the agency's regulatory practices. As just recently stated, the Board of Acupuncturists is committed to upholding the well-being and the safety of the public by overseeing the practices of acupuncture in the state of Maryland. Recognizing the dynamic nature of healthcare practices and the evolving landscape of the industry, we believe that more frequent board reviews can be an essential part for these emerging challenges and proactively addressing any issues. Again, we're in favor of this change, and if you have any questions, we're available to answer. So thank you.
Thank you, Ms. Purnell. Do I have any questions for this witness or any of the witnesses on this bill? That will end the hearing on Senate Bill 236. And Ms. Grant, you're free to go. Thank you very much.
Thank you very much.
Thank you. Finally, our last bill of the day, Senate Bill 225, and I think we have and Andrew, I always murder your name, Andrew Fulgenetti and Davika Burke. Thank you both for being here.
That was pretty close, Chair Bidle. Thank you. Good afternoon, Chair Bidle, Vice Chair Klossmeyer, members of the committee. For the record, my name is Andrew Fulgenetti. I serve as Legislative Director for the Maryland Department of Labor. This is our department's first bill hearing this session, short and sweet sunset bill, first of many, but only one today. We're bringing before you today Senate Bill 225, which seeks to extend our MOSH Advisory Board by 10 years. And with me is our Commissioner of Labor and Industry, Devki Virk, who's going to go into a little bit of details about the board.
Good afternoon, Madam Chair, members of the committee. I'm Devki Virk, Commissioner of Labor and Industry in the Department of Labor for the state of Maryland. The MOSH Advisory Board assists our Maryland Occupational Safety and Health Plan, which is a plan established by state statute to serve the occupational safety and health needs of more than 2.5 million public and private sector workers in the state. The advisory board assists the MOSH program, which is in my division of labor and industry, particularly with respect to development of standards for occupational safety and health that would apply to workers across the state. It is also a requirement of our MOSH state plan, which operates under the guidance and oversight of federal OSHA, the Federal Occupational Safety and Health Administration, that we have a board similar to the MOSH Advisory Board to assist with the development of standards and in that process. And with that, I'm happy to answer any questions that the senators may have. Thank you for letting me be here today.
Thank you for your testimony. And Andrew, I have a request of you. We'd like something in writing for our bill file that Department of Labor supports this bill. If you could do that for us before we vote on the bill, I'd appreciate it.
Absolutely.
Thank you. Senator Lamb.
Yeah, thank you, Madam Chair. Just a quick question. I understand that OSHA, I think on the federal level, allows states to take on the occupational health and safety responsibility if they choose to do so. Obviously, we have MOSH here that does that. In that regard, the state then has to establish or carry through with regulations that are at least as stringent as the federal OSHA standards. Is that correct?
That's correct. At least as effective as.
Got it.
the
Okay.
Federal OSHA.
All
Yes.
right. And so it just can't be less than the federal standard. It has to be at least as effective as, or it could be greater depending on statute or regulatory authority that MOSH might exercise.
That's
Right.
correct.
Okay. All right. Thank you.
Thank you, Senator. Any other questions? Thank you very much for being here.
Thank you.
That ends our hearing for today. We are going to have a briefing from technology.
Yeah,
ITO. So if you can just wait a few minutes. Thank you.